What is fibromyalgia? Juvenile primary fibromyalgia syndrome is an extremely painful, often chronic condition diagnosed during adolescence or the teenage years that causes widespread pain and fatigue and impacts females more than males. Research suggests that some people are genetically predisposed to fibromyalgia. However, there is generally some sort of trigger, such as a trauma or a seizure or emotional stressor that triggers the disease. According to Cincinnati Children's Hospital, patients with juvenile primary fibromyalgia syndrome are stuck in a vicious cycle of pain, fatigue, poor sleep, and decreased exercise. Each part of this cycle impacts the others. Understanding the cycle and how it impacts the child as a whole is very important to treatment. Since the pain experienced is impacted by factors such as activity level, stress, anxiety, and weather changes, studies now suggest that children with juvenile primary fibromyalgia syndrome are best treated by applying a multidisciplinary approach that includes not just medication, but also physical, alternative, and cognitive therapy as well. Many factors contribute to fibromyalgia, and each should be addressed for treatment to be successful. It includes treatment with medication, physical therapy, alternative therapy, and cognitive behavioral therapy. In a study by Kimura in 2000, a group of 33 juvenile fibromyalgia patients were studied along with a group of 33 regular same-age patients. In the study, they measured factors such as aches and pains, fatigue, depression, and irritable bowel syndrome. The blue on the chart represents fibromyalgia patients who overwhelmingly complained of problems across the board as compared to their peers. Because of this study and studies like this, we are now seeing that children may receive benefit from a variety of medications for a variety of issues. They may receive benefit from medications to help with sleep issues. Children with fibromyalgia liken their pain to having flu all the time, having flu-like symptoms that never go away. Over-the-counter medications are not proven effective in children with fibromyalgia. Also, opioid analgesics are not used very readily by doctors because of the risk of dependency for children. Because of this, we also now use muscle relaxers to help treat pediatric patients. Muscle relaxers work to release the stress on the muscles, to relax the muscles, especially during muscle spasms or tension headaches. Medical professionals are now using vitamin therapy as well because studies are showing that children with fibromyalgia are low in vitamin D. We are also using vitamin B complex and coenzyme Q10 now. Medication is sometimes used for secondary symptom management as well, such as irritable bowel syndrome and depression. Physical and alternative therapy can benefit fibromyalgia patients. Temporary relief can be found through water therapy and yoga therapy. Children are also treated through traditional physical therapy, with the main goal being to resume to daily stretching and daily exercise because this is the only thing shown to reduce the pain long term. Cognitive therapy is beneficial for coping for children. Often patients and their families are aggravated because of multiple misdiagnoses. Both child and family should be included in a successful treatment plan with the goal being to return to normal activities that so many of these children have withdrawn from. We also need to understand the complex cycle of fibromyalgia, and the child and their family needs to understand this cycle. According to Cincinnati Children's Hospital, the cycle feeds itself. Pain causes poor sleep. Poor sleep causes little exercise and increases the sensitivity to pain. When the sensitivity to pain is increased, it makes it harder to sleep and less likely to exercise, and so on and so on. We also need to try to prevent and recognize the symptoms of depression through cognitive behavioral therapy, and sometimes this is done through support groups. Because the pain experienced is impacted by multiple factors, such as activity level, stress, anxiety, and weather changes, studies now suggest that children with juvenile primary fibromyalgia syndrome are best treated by applying a multidisciplinary approach that includes not only traditional medication, but physical, alternative, and cognitive therapy as well. Medications may be used in treatment to help with problems such as non-restorative sleep, pain relief, muscle spasms, and secondary issues, with vitamin and mineral supplementation widely used now. Physical therapy, including water therapy, yoga, and traditional guided therapy, is very important, with the goal being to resume a daily home exercise routine. And cognitive behavioral therapy, where children and their families are taught coping skills, depression warning signs, and goal-setting techniques should also be included. In conclusion, juvenile primary fibromyalgia syndrome is a horribly painful, often chronic condition impacting children and adolescents. With proper treatment that focuses on the whole child, we can begin to break the cycle of pain. Are there any questions?
Why is juvenile primary fibromyalgia syndrome referred to as a cycle?
Because each area of juvenile primary fibromyalgia syndrome impacts the other. According to Cincinnati Children's Hospital, the cycle of fibromyalgia feeds itself. Pain causes poor sleep and little exercise, with inadequate sleep increasing the sensitivity to the child's pain. Because pain is increased, it becomes harder to sleep, and fatigue becomes unbearable to where there is little exercise, and the cycle just continues.
Is fibromyalgia genetic?
Research suggests that up to 75% of people with fibromyalgia have a family member who also suffers from fibromyalgia. So, yes, there is some sort of genetic predisposal to fibromyalgia, but there is also generally some sort of trigger that starts the incidence of fibromyalgia, such as a seizure, trauma, or an emotional or physical stressor.